Good afternoon, students. Today I'll discuss about urinary elimination. Under the urinary elimination, I will to say about retention of urine. So, what is retention of urine? Retention of urine is defined as inability to empty the bladder completely or incompletely. During the urination, urine from the bladder sometimes completely removed out and sometimes will be not completely removed out. Some urine will be remain in the bladder, that is known as retention of urine. तो बेले बेले कौन हुए ना ब्लाडर रू संपूर्ण भाव में यूरिन रिमूव हो जाए कम्प्लीटली ब्लाडर रू यूरिन रिमूव आउट मूव आउट हो जाए बेले बेले कौन हुए ना यूरिन मध्यम ब्लाडर किसी रही जाए थाए. So that is known as retention of urine. So inability to empty the bladder completely or incompletely. So completely bladder रू यूरिन रिमूव हो न थाए ब्लाडर संपूर्ण भाव में यूरिन रही जाए थाए बा किसी यूरिन मध्यम ब्लाडर रे जदि रिमूव पर मध्यम किसी रही जाए थाए ताकू रिटेंशन ऑफ यूरिन कहि था. Then what are the causes for the urine retention? When the spinal cord there has the spinal cord injury, in the spinal cord injury the vertebral level is the thoracic 12 vertebra and lumbar 2 vertebra will be affected. That is cause the sometimes that is cause the some problem some disc problem also, and cauda icuna syndrome, like the nerve root of the cauda icuna becomes compressed and that causes the disturbed in the sensory and motor function, and problem will like the tepes dorsalis. In the tepes dorsalis we know that syphilis is a bacterial infection that spread by the sexually. When syphilis is untreated, that bacterial damage to the spinal cord or peripheral neurons. Okay, so जेतला हम स्पाइनल कॉर्ड इंजुरी होची स्पाइनल कॉर्ड रो जो वर्टिब्रल लेवल अछि थोरासिक 12 बा लुम्बार 2 वर्टिब्रा ता मध्य इंजुरी होची बा कॉडा इकुना सिंड्रोम रे कोन हुए ना हमरो कॉडा इकुना जो नर्व रूट थाए सेटा कंप्रेस हो जाए जहाँ फल कि सेंसरी मोटर फंक्शन डिस्टर्बेंस होता है. देन हूँ टेपेस डर्सालिस रे कौन हुए ना आम जाचे सिपिल्स हूँ गोटे बैक्टेरियल इन्फेक्शन जहाँ से सेक्सुअली द्वारा ट्रांसमिशन होता है. जिते सिपिल्स ठीक भाव ट्रिटमेंट सिपिल्स ट्रिटमेंट ठीक न सिपिल्स ट्रिटमेंट ठीक भाव हो न था जिते कौन हुए ना बैक्टेरियल स्पाइनल कॉर्ड को डैमेज कर दे था एवं पेरिफेरल नर्वस टिश्यू को डैमेज कर दे था. सो यह फर्स्ट कॉज स्पाइनल कॉर्ड इंजुरी दैट बाय व्हिच आवर यूरिन it is also affect to the bladder, by which from bladder the urine will be completely the urine does not completely removed or some urine will remain in the urinary bladder. Then is the spinal shock. Spinal shock is also another cause by which the urine also be retained in the urinary bladder. So spinal shock is a clinical syndrome that is characterized by the loss of reflex, motor and sensory function below the level of a spinal cord injury. तो जो स्पाइनल कॉर्ड इंजुरी जोटी होती लेवल से लेवल तल को सेंसरी मोटर फंक्शन लॉस हो जाए रिफ्लेक्स लॉस हो जाए ताको आम स्पाइनल शॉक कही था. इट इज ए वन टाइप ऑफ न्यूरोलॉजिकल इंजुरी बाय व्हिच पेशेंट्स गोज टू द रिटेंशन ऑफ यूरिन. इट इज अफेक्ट टू द यूरिनरी ब्लैडर. Metabolic disorders such as diabetes mellitus, chronic alcoholism also, these are the causes. And in the metabolic disorder, that is diabetes mellitus, chronic alcoholism, polyuria, peripheral polyneuropathy, these are the causes for the retention of urine. The metabolic disorder such as diabetes mellitus, in the diabetes mellitus there has the increased glucose level in the blood, and because body cannot take up enough glucose to produce the energy. For that reasons the diabetes mellitus occurs. Persons who are in the alcoholism, persons who take alcohol, and it will be adjudicated to the persons that is known as chronic alcoholism. It is another cause of the urinary retention. Persons who are goes to the persons who has in the polyuria, in the polyuria there is a excessive urinations. Persons always goes to the for the urinations. And a peripheral polyneuropathy, that is a there has multiple peripheral nerve damage occurs outside of the brain and spinal cord, that is known as peripheral polyneuropathies. So metabolic disorder अच्छी कौन हुए ना डायबिटीज मेलेटस, क्रोनिक अल्कोहोलिज्म, आउट होची पॉलीयूरिया जो थे कि व्यक्ति एक्सेस यूरिनेशन बारंबार यूरिनेशन करें. एंड पेरिफेरल पॉलीन्यूरोपैथी रे इंडिविजुअल मल्टीपल पेरिफेरल नर्व डैमेज हो जाए. ये मल्टीपल पेरिफेरल नर्व कौटी थाए ना ब्रेन स्पाइनल कॉर्ड जो आउटसाइड रे मल्टीपल पेरिफेरल नर्व था सब डैमेज हो जाती. ओके, देन another other cause like the metal poisoning, that is take the lead, mercury, that has also caused the peripheral polyneuropathy. In peripheral polyneuropathy, multiple peripheral nerves becomes damaged which are present outside of the brain and spinal cord. When you take the medication like the antidepressant for the reduce the depressions, and the sedative medications for induce the sleep, when that this type of medicine taken, that also causes the retention of urine. And history of fecal impactation, in the fecal impactions there is a hardness of stool will remain in the colon and rectum. And persons in the encopresis, that is stool will collect in the rectum and colon, what there has the leakage. रेटम कॉलन स्टूल कलेक्शन हुए कि लिकेज थाए ताको एनकोप्रेसिस कहती. ओके, रेटम कलेक्शन से स्टूल लिकेज हो बाहर को चली आसे. देन इज द डेट्रूसर, इज ए आनंद डेट्रूसर कंट्राक्शन that has strengthened and urethral resistance to flow. So it is another cause. In the we know that detrusor muscles contracted detrusor muscles that helps for the that main function is the contraction during the urinations for the pushing of the urine out of the bladder and into the urethra. And detrusor muscle will be relaxed to allow the storage of urine in urinary bladder. So the another it is a when the detrusor contraction strengthen and urethral resistance of flow. When the detrusor when urinary retention occurs by the effect to the detrusor contraction. So main function detrusor muscle contraction will be helpful for the push the urine to out of the bladder. And another role of the detrusor muscle is that it will be relaxed to allow the storage of the urine in the urinary bladder. When the detrusor muscle will be affected, the contractions of muscles will be less contraction of the muscles occurs, and by which the urine will be cannot push to the push urine out of the bladder. And other causes the dental surgery regarding including that is including the general or spinal anesthesia. When general spinal anesthesia given to reduce the pain of the patient during the surgery, by which it will be sometimes it will affect the bladder and urine will be accumulated. And there is the if the patient patient in the AIDS patient has the AIDS, that is acute syndrome, that is also in some cases that is also it is another cause of the retention of urines. Okay, so these are the causes by which the urine will be retained to some extent. Then the come the physical examination. In the physical examination, first do the history collection and recording the vital sign, that is the temperature, pulse, respiration, blood pressure, and do the inspection, palpation, percussion of the lower abdomen for to know the bladder distension. So inspection first observe the skin condition by palpation method. We put here the finger of the palm to know about the any masses and in the tenderness in tender will present, and the percussion method to know the about that that is the gas is present not in the abdomen. Then the neurological examination, including the perineal skin sensation. In the perineal skin sensation, uses a safety pin and other sharp object to perineum area, skin of perineum area, and patient said that in which area he feels pain by the pain prick. Okay. And another neurological examination is known as bulbocavernosus reflex. In the bulbocavernosus reflexes, it is tested by the compressing the glans penis in males or applying the pressure in the clitoris of the female. So physical examination रे आम हिस्ट्री कलेक्शन करिबा, vital sign, temperature, pulse, respiration measurement करिबा. inspection मेथड रे ब्लाडर डिस्टेंशन कंडीशन को ऑब्जर्व करिबा. palpation मेथड रे फिंगर यूज करिकी पाम तो फिंगर यूज करके आम साइड प्लेस करके आम जानी परिबा किछि मासेस किंबा किछि गैस रही कि नहीं. परकस मेथड जानी परिबा जे किछि साउंड आछछि कि नहीं ब्लाडर ब्लाडर किछि साउंड किंबा ब्लाडर डिस्टेंशन मते ठीक भाबरे जानी परिबा. এবং ব্লাডারে ୟୁରିନ୍ ফুল ହୋଇକି ଅଛି କି ନାହିଁ ତା ମଧ୍ୟ ଜାଣିପାରିବା. and neurological in the neurological examination we test to the perineal skin sensation. In the perineal skin sensation we used the safety pin. In the safety pin we do the pin prick to the perineal skin of the perineal area, and patient said that in which part that will be feel pain of the perineum area. And do the other neurological examination like the bulbocavernosus reflexes. In the bulbocavernosus reflexes, it is a test by which we compress the glans penis in males and gives the pressure to the clitoris in the female. Okay. Then we determine the urinal residual volume. If the urinal residual volume less than 50 ml, that is the normal. If it is greater than 200 ml, that is the abnormal. Okay. Patient should provide a urine sample for urinalysis and culture. तो sample आम गोटे यूरिन sample देकी पेशेंट को यूरिन टेस्ट जानिबा एवं यूरिन कल्चर करिबा. And inspection of external genitalia and urethral meter should be done for observe the any pallor and thickness of the tissue. तो inspection आम external genitalia by urethral meters रो inspection करिबा कोन पे सेतरे किछि pallor बा thickness of the tissue रही छि नै जानिबा. Okay. And residual volume also be determined by the catheterization or by ultrasound unit that can estimate the provided residual urine. Residual urine आम केमती अछि जानिबा ना catheterization procedure केते urine जानि परिबा एवं ultrasound unit माध्यम रे मध्य residual urine केते प्रेजेंट रहि छि ता हम जानि हबो. Okay, then come to the management. In the management, assess severity of the retention, assess the condition of the patient, assess the male gland during the voiding. If the patient do the standing, then give support. If the patient do urination in the sitting position, the assess the any help is not needed. But in the standing position, patient needed the help or any anybody else can help to the patient during the voiding in the standing positions than the sitting position. Provide the privacy to patient to prevent the to reduce the sameness of the patient, to prevent the sameness of the patient, and provide the warm bedpan urinal to the patient for the collector of the stool as well as the urine. And a local application of heat or hot water bottles should be applied to the muscle, that is helps for the relaxation of muscle, and patient goes to the micturations to do the urinations. So in local application आम कौन करूँ ना हट वाटर बटल बा हिट अप्लाई करि थाउ मसल उपरे तापर मसल रिलैक्सेशन होई थाए एवं मिचुरेशन ठीक भाव में पेशेंट होई पारि थाए. Provide the emotional psychological support to the patient for the reduce the anxiety, provide hot enema and that relieve the retention of the urine. So hot enema, if hot enema given, then it is helpful for the relieve the retention of urine, and giving the more fluids to the patient for the urination purpose. Give lemon drinks, warm tea, plenty water for the to induce the urination, and if the by the hearing of the running water and flushing the toilets, that also stimulate the maturation reflex to the patient. So if the patient has urination but patient unable to do it, then at the time running water, you will open the tap and running water should be flow on the toilet floor, and during the flushing the toilet at the time, by stimulation of the maturation reflex to the patient, through the maturation reflex patient goes to toilet and do the maturations. And also we in the bed, if you see he or sees here running water and flushing the toilet, that also stimulate the maturation reflex to patient, and patient do the urinations. In the client family teaching, instead of the client or family to maintain a drainage system below level of the symphysis pubis. Okay, so drainage system को सबले symphysis pubis level तल को रखा कुआ जाता है, and bedside linens and cloths should be clean, and teach the client and family member clean the indwelling catheter, जो catheter द्वारा urination urine को remove करा जाउछि urinary bladder रो, तो से इंडोलिंग कैथेटर को भल भाव में नीट एंड क्लीन करके रखापी, कारण इट हेल्पफुल टू प्रिवेंट द इन्फेक्शन एंड मैनेज द यूरिनरी इनकंटिनेंस एंड यूरिनरी इन्फेक्शन. Next, come to the urinary incontinence. Urinary incontinence is defined as inability of urinary sphincter to control the passage of urine from the bladder. So you know that in the urinary bladder and the urethra there has the urinary sphincter, and that sphincter allow for the passage of urine from the bladder through by the urethra to outside. So there has the urinary sphincter that becomes open, that becomes relaxed because pressure from the bladder, so that allow the urine goes from the bladder through by urethra to outside. But here in the urinary incontinence, what happen due to the inability or non-capacity of the urinary sphincter to remove out the urine from the bladder. So urinary sphincter एथिरे capacity नहीं बा तार सेटा inability अच्छी यूरिन पैसेज को यूरिन को ब्लाडर रिमूव करिया पई ब्लाडर रो यूरिन को रिमूव करी आउटसाइड को थ्रो आउट करिया पई यूरिन स्पिंचर कैपेसिटी नहीं बा यूरिन स्पिंचर कंट्रोल तार यूरिन स्पिंचर कंट्रोल पावर नहीं जे जे यूरिन को ब्लाडर रो आउटसाइड को रिमूव करिया पई ओके यूरिन स्पिंचर किसी डेफिसिट रही जहाँफल कि व्यक्ति ठीक यूरिन स्पिंचर से रिलैक्सेशन हम ना एवं यूरिन ब्लाडर रू रिमूव आउटसाइड को हो पार ना ओके so types then come the types of urinary incontinence. First is the transient, that is acute. Okay, transient, that is the known as acute. Okay, transient stage of the urinary incontinence is it is a sudden onset and it is associated with the medical and surgical condition. So certain type of medical and surgical disorder or during the any type of disease and in the surgery due to the any type of surgical procedures in the in the bladder that causes the incapability of the defected to the urinary sphincter or any disorder found in the urinary sphincter at the time of the operations or the surgery in the in the surgery in the urinary bladder area and on the surgery procedures involved in the perineal area at the time what happen that due to by which the urinary sphincter's capacity becomes very low, it will be dysfunction by which urine cannot be moved out from the bladder. Then come to the established incontinence. It is another type of the urinary incontinence. In the established incontinence, it is a sudden onset, या मतलब sudden होता है and gradual onset. ये sudden होता है बा gradually धीरे धीरे होता है. Okay. And established urinary incontinence occurs by the some symptomatology or pathophysiological abnormalities, okay, by which this type of urinary incontinence occurs. Okay, so in the presenting symptomatology, that is include the stress, it overflow, urge. These are the symptomatology. When the patient remains stress conditions or patients always urge to the voiding, and when the urine will be overflow, okay, by which that condition established incontinence occurs. And pathophysiological abnormalities such as instability, incompetent urethral sphincter mechanism, by which pathophysiological abnormalities occurs when the patients in under the instability urethral detrusor muscles has the instability, there is a less contraction power of the urethral detrusor muscles, and patients who have the incompetent urethral sphincter mechanism, that type of persons undergo the pathophysiological abnormalities, and it is known as established, it is by which established incontinence occurs. Okay, তাহলে एस्टाब्लिश इनर कंडिशन कहीं होता है ना एस्टाब्लिश इनर कंडिशन साधारण सडन होता है कि धीरे धीरे होता है या साधारणतः सिम्पटोमोलॉजी रे प्रकाश करे जाए कि पैथोलॉजिकल एब्नॉर्मल जो होता है सिम्पटोमोलॉजी रे जतले व्यक्ति स्ट्रेस कंडीशन रहउची कि यूरिन ओवरफ्लो हो जाउची कि व्यक्ति बारंबार ताको यूरिनेशन लागुची तो से एस्टाब्लिश यूरिनरी इनकंटिनेंस होता है कि व्यक्ति जो पैथोलॉजिकल एब्नॉर्मलिटी आम पाई था सच एज जो the loss of the muscle power to contact, that is the loss of power of the detrusor muscle contraction, जो detrusor muscle contraction power कमी जाता है कि यूरेथ्रल स्पिंचर मेकानिज्म यूरिनरी स्पिंचर मेकानिज्म कमी जाता है तार पावर कमी जाता है जो एस्टाब्लिश्ड यूरिनरी इनकंटिनेंस होता है. लाफिंग एवं क्राइंग समय यूरिन लीकेज हो जाता है ताहा मध्य गोटे प्रोब्लेम अटे एस्टाब्लिश्ड यूरिनरी इनकंटिनेंस रो. Then the stress incontinence. Stress incontinence occurs when there is the loss of urine. The loss of urine occurs in the person by the involuntary, and it will be commonly occurs during the laughing, during the childbirth, during the childbirth, and during the stitching also. And during the childbirth, due to increased intra-abdominal pressure, that causes the stress urinary incontinence. So what that is the stress urinary incontinence. That means during the stress period, the urinary incontinence occurs. The urinary sphincter has a loss of function to control the passage of urine, so that from the bladder, so urine will be overflow. Okay, and that will not controlled by the urinary sphincter. तो यूरिनरी इनकंटिनेंस कौन हुए ना, यूरिनरी स्पिंचर फंक्शन ठीक रे हुए ना, से कौन करे यूरिन पैसेजर कंट्रोल को ठीक भाव में करें ना, तो यूरिन कौन हुए ऑटोमेटिकली मूव बाहर को रिलीज हो जाए. ओके, ब्लाडर रू रिमूव आउट हो जाए. तो स्ट्रेस इनकंटिनेंस कौन है ना, व्यक्तिर यूरिनटा अनिच्छा माने तार इच्छा ना किंतु तार अनिच्छा सत्वे भी यूरिन लॉस हो गला. एवं साधारणतः लाफिंग समय स्नेजिंग समय किंबा ड्यूरिंग द लेबर, that is by the intra-abdominal pressure, that causes the stress causes the stress incontinence, urinary incontinence. ताहले व्यक्ति इनवॉल्युंटरी यूरिन लॉस करि थाए जेतले स्नेजिंग करे, लाफिंग करे किंबा बेबी बर्न समय लेबर समय कौन हुए जेतले एब्डोमेनल प्रेशर अधिक हो जाए, सेतले मध्य यूरिन रिलीज हो जाए एवं से समय कौन हो स्ट्रेस इनकंटिनेंस यूरिनरी इनकंटिनेंस देखा जाए थाए. देन नेक्स्ट टाइप इज द अर्ज. Then come to the urge urinary incontinence. In the urge urinary incontinence, what happen? So at the time patient before getting toilet, patient experience loss of urine. Here the patient patient cannot go to the toilet, but inability to go to the toilet, and patient doesn't want to go to the toilet. Okay, but patient experience the loss of urine. टॉयलेट जावा पूर्व पेसेंट सब भाव तार यूरिन लॉस हो चलती कहते अर्ज यूरिनरी इनकंटिनेंस. देन कम टू द ओवरफ्लो यूरिनरी इनकंटिनेंस. इन द ओवरफ्लो यूरिनरी इनकंटिनेंस, it is associated with the over distension and overflow. Okay, over distension and overflow the bladder, जो bladder overflow bladder यूरिन overflow हुए किंबा डिस्टेंशन जी रहा ताठ अधिक डिस्टेंशन ब्लाडर यूरिन आकुलेशन जो होता है से लॉस यूरिन आमर इच्छा आम इनवॉल्युंटरी भाव में यूरिन लॉस हो जाए, इच्छा नथिले भी यूरिन लॉस हो जाए. ओके, ताको कहते ओवरफ्लो यूरिनरी इनकंटिनेंस. देन कम टू द नेक्स्ट स्टेप एफ, फंक्शनल यूरिनरी इनकंटिनेंस. In the functional urinary incontinence, person has inability to go to the toilet, person has a loss of ability to go to the toilet because he or she is the bedridden patient, but at the time urine will be lost because due to the physical limitation. तो व्यक्ति टॉयलेट जावाई अक्षम सत्वे भी तार यूरिन लॉस होची, तो यूरिन लॉस होता है ताको आमे कहि थाउ functional urinary incontinence. Then come to the reflex urinary incontinence. In the reflex urinary incontinence, what happen? There has no sensation, but bladder will be empty and urine will be removed out from the bladder. Okay, then next type is the total urinary incontinence. In the total urinary incontinence, due to the any type of a surgical due to any type of surgery or surgery in the or in the surgery or due to the any type of trauma or due to the physical deformity or physical malformation out of the physical limitations by which that results the loss of urine ଯେତେବେଳେ ବ୍ୟକ୍ତି କୌଣସି ସର୍ଜରୀରେ କୌଣସି ସର୍ଜରୀ ପ୍ରୋସିଜର କରାଯାଉଛି ବା କିଛି ସର୍ଜରୀ ହେଇସାରିଛି ବ୍ୟକ୍ତିର କିଛି ଟ୍ରମା ରହିଛି କିଛି ଆକ୍ସିଡେଣ୍ଟାଲ ଇଞ୍ଜୁରୀ ରହିଛି କିମ୍ବା ଫିଜିକାଲ ମାଲଫରମେସନ୍ ସେ ଫିଜିକାଲି ଲିମିଟେସନ୍ ରହିଛି ତାର ଲିମ୍ସର ହେଉ କିମ୍ବା କୌଣସି ଅର୍ଗାନରେ ଡିଫର୍ମିଟି ରହିଛି ତ ସେହି ସମୟରେ ବ୍ୟକ୍ତି ମଧ୍ୟ ବ୍ୟକ୍ତିର ୟୁରିନ୍ ଲସ୍ ହୋଇଥାଏ ଇନଭଲଣ୍ଟାରୀ ଲସ୍ ହୋଇଯାଏ ତାକୁ ଟୋଟାଲି ୟୁରିନାରୀ ଇନକଣ୍ଟିନେନ୍ସ କହିଥାଉ ଓକେ then come to the classification based on emptying of the bladder the bladder urine empty bladder empty को नेकी दीटा पाके क्लासिफिकेशन करा जायछि गोटे one is the complete and the second is the incomplete in the complete urine will be totally empty from the bladder in incomplete means there is has the dribbling of the bladder without total drainage एथरे ब्लैडर किसी यूरिन रह जाई थाए ताको कहते इनकम्प्लीट so classification based on the empty bladder it is of two types that is first complete and incomplete in the complete total urine will be empty from the bladder and in the incomplete some urine will remain in the bladder the urine completely not removed from the bladder okay so with the total drainage there is the dribbling of the bladder then come to the assessment we assess the patient conditions and also we assess the what type of urinary incontinence present in the patient if the when we see that there is pelvic floor muscle very weak that we also confirm that patient undergo the stress urinary incontinence when the patient take excess intake of the caffeine and cited juice that that is cause the arch urinary incontinence when the patient has not capacity to control the urine leakage that means patient has the there is no capacity of patient to coping with the situations when we know that assess that the perineal tissue will be attached with the urine which is removed from the urinary bladder it causes the breakdown of the skin elasticity and impact the skin integrity okay next come to the management in the management first we provide the education in the educations first is the prompted voiding will instruct the patient for the prompting voiding so for that reasons we established regular voiding schedule and also instruct the patient to do the habit training for the habit training we instruct to the void by the patient goes to the toilet by clockwise method in the clockwise there has increased interval from every 45 to 60 minutes to every 2 to 2.5 hours okay so instead the patient to do the habit training in the habit training by seeing the clock then go to the toilet so by which the patient always goes to the toilet and that will be that interval will remain from the 45 to 60 minutes and to every 2 to 2.5 hours व्यक्ति प्रत्येक 45 ରୁ 60 मिनिट रु 2.5 घंटा पर्यंत 2.5 इंटरवल रे कौन करिवो ना से टॉयलेट जदि जाई थाए सबले गला ताहले तार हैबिट होई जिवो एवं से समय जिवो ता यूरिनरी इनकंटिनेंस देखा जिवो नै then come to the bladder training in the bladder training during the toileting clients should be sit on the commode in the every 1 to 2 hour, that is depend on the frequency of urination or micturations. So in the bladder training, gland should be placed on the commode toilet. Here the patient sit in the on the commode toilet for the so place the plant in a commode on the toilet every 1 to 2 hour depending on the frequency of micturations. So micturation अनुसार व्यक्ति कौन कर ना कमोड टॉयलेट कमोड उपरे ताको प्लेस करेबो से सिटिंग रे से टॉयलेट करी थाए प्रत्येक 1 ରୁ 2 घंटा भितर करी थाए। यह साधारणतः मिचुरेशन से को समय जाउछि से अनुसार ब्लैडर ट्रेनिंग दिया जाय थाए। नेक्स्ट कम टू द एक्सरसाइज। If the patient goes patient goes to the exercise in the morning evening, it improve their health and improve the muscle tone, and that also help for the control the urinations and the voiding. Then the diet care, we give the patient decaffeinated tea, non-citrus fruit juice, okay, that that minimize fluid intake after every meal. Okay, so in the diet care, we given the diet care to the patient. So in the diet care, we give the decaffeinated tea and non-citrus fruit juice to the patient. In non-citrus fruit juice, there is have the grape, apple, cranberry, etc. Then mixing with each fruits and then will be grinded. Then that juice is known as non-citrus fruit juice that will provide to the patient for the better voiding. And after every meal, minimize the fluid intake. Okay, and in the skin care, we provide the neat and clean to the irritation skins. Change the wet linen every time after the urinations, and they clean the perineal area by the soap water because it reduces the infections as well as the decubitus ulcer. And notify the doctor if patient has the red irritation on the skin. Okay, so urinary retention and incontinence is over.